Miss Sally. My name is Molly. I'm going to be your nurse today. I have a few medications to give you this morning, but before I do that, can you tell me your name and date of birth? I'm going to check your wristband while you do. Sally Joe, 9/20/1950. Thank you very much. I'm going to perform some hand hygiene and give my patient some privacy. Sally, before I give you medications, it's always important to check if you have allergies. Do you have any allergies that you know of? It says here, according to your MAR, it looks like you have a penicillin allergy. Is that correct? Okay, so I've made note of that, and I made sure to check my MAR just to make sure that we're not giving anything that would cause an allergic reaction. I verified my orders. I'm gonna put on some gloves. All right, so I'm gonna come over here to my med cart. And you wanna make sure that you're explaining all the medications that you're gonna be giving to your patient. So I see here, it's 9 o'clock. So I'm going to be giving Lasix, a clindamycin injection, regular insulin, and NPH insulin. And those are all scheduled for 9 o'clock. So we'll do the PO medications first. So I'm going to get out my Lasix. All right, so while I'm at my drug cart, I'm going to double check the name of the drug. We've got Lasix, and we've got it for Sally, and her date of birth. And I'm gonna be giving 10 milligrams. And so this says 10 milligrams. I'm giving it PO by mouth. It's every 12 hours. I'm giving it for hypertension, and I'll be giving it at 9 o'clock. So I'll come in here to Sally. All right, Miss Sally, I'm gonna double check your wristband. Can you tell me your name and date of birth again? Check her wristband. I have Lasix for you. I'm just gonna double check with my MAR to make sure that I have the correct dose. So I have Lasix, I'm giving it at 9 a.m., 20 milligrams, PO by mouth. Miss Sally, this is for your hypertension. And I will document that in my MAR. So I'll open this up and give that to her. And you wanna make sure that she swallows her medication. You can also assist her in taking it if she needs. So she's taken that. I'll remove these gloves. In real life, you would be probably grabbing all the medications at once, but for your checkoff, you're gonna be coming back and forth. So the next medication that I'm gonna be giving is a clindamycin injection, scheduled for 9 a.m. So I look here, I have my clindamycin. It's for Sally at 9 a.m. I'm gonna be giving 300 milligrams. And this is 600 milligrams per 4 milliliters. So I'm going to be giving half of that. So I'll be doing 2 milliliters. Don't be afraid to, if you need to, write down your medication administration and do the math just so you're sure that you're giving the correct dose. So I'm going to be giving 2 milliliters. And this is for her infection. And I'm going to be giving it IM, ventricular. So I'll put my gloves on. I've already performed hand hygiene. You can always reference your Davis drug guide here. All right, we'll grab our IM needle out. Got my alcohol pad. I'm gonna wipe the top of this. Pull up 2 milliliters. Get all the air bubbles out. Okay. So we have our 2 milliliters of the clindamycin. And I will bring an alcohol pad into the room just to make sure that we get the site nice and clean. And you can also do a Band-Aid for an IM injection if you think it will bleed. You don't want to rub the site though. Okay, we're gonna come over here just so you can see a little bit better. And you want to bring the actual medication with you so that you can either scan it or write it down in your MAR. Most cases you'll be scanning it, hopefully. So we've got Miss Sally. I'm going to check your wristband again. And we'll be giving you clindamycin, 300 milligrams or 2 milliliters. And we're giving this every day for an infection, and it's 9 a.m. And I'll be documenting this afterwards. So first I'll do it in here, and then I'll turn her over and show you where we would do it on her. Get all your supplies ready. You're going to be doing this at a 90-degree angle. So you'll clean in a circular motion. And with the IM, you're going to be using the Z-Track method. So we'll clean that for at least 10 seconds. We'll let it dry. Be very careful once you uncap the needle. All right, so we'll do our Z-Track method. I'm going to do 90 degrees, like a dart. Pull out, and then you'll activate the safety needle on there. Miss Sally, would you like a Band-Aid? Okay, we'll give you a Band-Aid. Like I said, don't rub the site. We'll throw all this away, and then I'm going to put this in the sharps container. All right, so I'm going to show you on Sally where we would have done the IM injection. So you're going to put your thumb here on her greater trochanter, and you want your index finger pointing towards her abdomen, and then you'll spread the skin right here, and in between these two fingers is where you're going to do the IM injection. All right, Sally, we're going to get you in a more comfortable position, and then I have your sub-Q insulin to give you, okay? We're going to do that in your belly. Blink back on while I'm getting your medication ready, so you stay warm. All right, I'll take off my gloves since I just touched my patient. I'll wash my hands. Come over to here to the med cart and take a look at my MAR and orders. Put on a new set of gloves. Okay, so it says here that her blood sugar, I've obtained it, and it was 185. So I'm going to be giving 5 units of regular and 5 units of NPH insulin. So the NPH is the cloudy, regular is clear. You always do clear before cloudy. Got my insulin needle here, and a couple alcohol swabs, one for the top of the vials, and then another for Sally's stomach. We'll take our Band-Aid off our little friend. Okay. So you always want to pull up the clear before cloudy. If you're going to be injecting air, you'll inject into the cloudy first, and then into the clear. And then draw up from there. our 5 units of clear. And be sure not to put any of the clear into the cloudy when you're drying up the cloudy, because then you're getting rid of the insulin that you drew up. All right, so then we've got 5 units of the NPH for a total of 10. So I'm going to double check this with my MAR. I've got Sally, it's 9 a.m. I'm giving regular insulin 5 units sub-Q for diabetes management. I'll document afterwards. And then I'm going to be giving NPH insulin 5 units sub-Q for diabetes management, documenting afterwards, also for Sally, 9 a.m. And then I'm going to have my second verifier, an RN, double check to make sure I have the right amount of insulin. And then we'll bring this into Sally's room along with our MAR. Hi Sally, I have your insulin for you, okay? I checked your blood sugar, it was 185, so according to my sliding scale, we're gonna be giving 5 units of the regular insulin and 5 units of the NPH insulin, okay? All right, so before we poke Miss Sally, I'm gonna double check your wristband with the MAR. We've got Sally and her birth date. It's 9 a.m. I'm giving regular and NPH insulin, 5 units of regular and 5 units of NPH, both sub-Q for diabetes management. It's 9 a.m. And like you would probably bring your vials in as well to scan them. All right, that all looks good.
Hi, I heard you wanted to give some insulin.
Yes, would you verify with me?
Absolutely.
We've got 5 units of the regular and 5 units of NPH for Sally.
All right, I need to make sure I got the right person. Okay, your measurements look good, thank you.
Thank you. All right, and then I would perform hand hygiene and put on a clean set of gloves since I came into Sally's room. All right, we are going to be giving this in your stomach, Sally, okay? It's just a little pinch. I'm sure you're used to it by now. So we'll grab a little bit of extra fatty tissue. I'll wipe off on here so you can see kind of where, but you'll squeeze the fatty tissue and wipe in a circular motion for 10 seconds. Okay, and then I would insert it right there. For this purpose though, we'll do it here on our little demo. So wiping for 10 seconds in a circular motion. I'm gonna do it at a 90-degree angle. So I'm squeezing the extra skin, darting motion, and then we're holding it there and releasing. And then this is a little safety mechanism, so we'll put that on. All right, Miss Sally, I'm gonna go run this to my sharps container. When I come back, I'll make sure you're all comfortable for the day, okay? Throw it this way. All right, since I left the room, I'll perform hand hygiene, put on a clean set of gloves. Sally, is there anything else I can do for you today? Other than give you your handy dandy call light. I'll hook it here to you so you can find it. Make sure that the room is safe. Here's your extra pillow if you need it. Brakes are on the bed. Here's your water. We'll open your curtain. And then I'm gonna go ahead and document all of that in the medical administration record.